Brace the rudders! Raise the sails! Raise the sails!
Captain, an unidentified ship is approaching. Over.
Roger. Wait, is that an enterprise sales solution?
Reach sales professionals, not professional sailors. With LinkedIn ads, you can target the right people by industry, job title, and more. Start converting your B2B audience today. Spend $250 on your first campaign and get a free $250 credit for the next one. Get started today at linkedin.com/campaign. Terms and conditions apply.
This episode is brought to you by Stouffer's. Here comes three-time juggling champion Natalia Rogers. She's juggling law school, her TA job. Oh, narrowly catches the laundry. What's that fourth ball? Parents unexpectedly showed up at dinner time? Is that too much for Natalia? Not with Stouffer's Chicken Alfredo and its mouth-watering mix of Asiago, Romano, and Parmesan. When you're juggling four things at once and the clock strikes dinner, think Stouffer's.
This is Dr. Ted O'Connell with the Med Prep to Go Step 2 Qbank podcast. Today we'll be reviewing 3 pediatrics questions. Just a reminder that you can find these questions and many more at medprep2go.com. If you have feedback or you'd like to get involved in this project, please email me at ted.medprep2go@gmail.com. And if you like what we're doing, please do let your friends know about it and consider leaving us a review. All right, let's go ahead and get started with the first question. A previously healthy 10-year-old girl is brought to the emergency department because of a 2-day history of increasingly severe abdominal pain. She has had anorexia for the past day. She has no history of serious illness and does not take any medications. Her temperature is 38.5 degrees Celsius or 101.3 degrees Fahrenheit. Pulse is 105 beats per minute. Blood pressure is 95 over 65 millimeters of mercury, and respirations are 20 per minute. On physical examination, she appears well-developed and well-nourished. Cardiopulmonary examination shows no abnormalities. Abdominal examination shows localized tenderness over the left lower quadrant, and there is guarding at McBurney's point. Bowel sounds are decreased. Laboratory studies show a leukocyte count of 15,000 per cubic millimeter and a hemoglobin concentration of 13 grams per deciliter. Urinalysis shows no abnormalities. Which of the following is the most appropriate next step in management? A, admission to the hospital for observation and serial examinations. B, CT scan of the abdomen. C, measurement of serum C-reactive protein concentration. D, surgical evaluation, or E, ultrasonography of the abdomen and pelvis. The correct answer is D, surgical evaluation. Appendicitis refers to acute inflammation of the appendix and usually results from appendiceal obstruction by a fecalith or lymphoid hyperplasia. Appendiceal obstruction leads to bacterial proliferation within the lumen and wall of the appendix, eventually leading to inflammation, infection, appendiceal necrosis, and perforation. Acute appendicitis typically presents with abdominal pain that is periumbilical at onset and may later migrate to the right lower quadrant, along with leukocytosis and tenderness to palpation. Bacterial proliferation causes leukocytosis, such as in this patient, which is predominantly neutrophilic. Patients often develop fever and may also experience nausea and anorexia. Multiple scoring systems exist to stratify cases into low, moderate, or high risk for appendicitis. Imaging with CT scan, MRI, or ultrasonography can assist in diagnosis. Low-risk cases can be discharged home if there is no right lower quadrant tenderness, or with reevaluation in 12 to 24 hours if there is right lower quadrant tenderness. Moderate risk cases typically benefit from imaging. High risk or classic cases such as this one require surgical evaluation. This is usually done before imaging to minimize radiation exposure as well as minimizing delay. Treatment involves administration of intravenous antibiotics and operative intervention, typically laparoscopic appendectomy, to prevent appendiceal rupture, which can lead to peritonitis or an intra-abdominal abscess? Answer choice A, admission to the hospital for observation and serial examinations, is incorrect. This patient presents with classic features of appendicitis and no clear alternative diagnosis. So the best next step is surgical evaluation. Answer choice B, CT scan of the abdomen, is incorrect. While CT scan of the abdomen can be helpful in diagnosing equivocal cases of appendicitis, it is associated with the risk of radiation exposure, which is a consideration, especially in a pediatric patient. Answer choice C, measurement of serum C-reactive protein concentration, is incorrect. C-reactive protein is an inflammatory marker that, while potentially increased in acute appendicitis, is nonspecific. It can be elevated in a variety of inflammatory conditions, and measurement would neither confirm nor rule out the diagnosis of appendicitis. While appendicitis is a clinical diagnosis, equivocal or uncertain cases can be further evaluated with imaging, such as ultrasonography, CT scan, or MRI. Answer choice E, ultrasonography of the abdomen and pelvis, is incorrect. Ultrasonography of the abdomen and pelvis can help confirm a diagnosis of appendicitis. However, further confirmation of diagnosis with a CT scan or ultrasonography should not delay operative evaluation and intervention in a patient with a clear clinical diagnosis of appendicitis and no other source of fever with a negative urinalysis. The key learning point here: high risk or classic cases of appendicitis require surgical evaluation, which should not be delayed to pursue imaging. Question 2. A 15-month-old boy is brought to the pediatrician by his parents for a routine well-child visit. The prenatal course and vaginal delivery were uneventful. The parents report that the child has been meeting his developmental milestones and has had no significant medical issues. Vital signs are within normal limits. On physical examination, the pediatrician notes that the anterior fontanelle is still open. The rest of the physical examination is unremarkable. Which of the following is the most appropriate next step in the management of this patient? A, check serum calcium levels. B, obtain a head ultrasound. C, reassure the parents and schedule a routine follow-up visit. D, refer to a pediatric endocrinologist. Or E, schedule a cranial magnetic resonance imaging or MRI study. The correct answer is C, reassure the parents and schedule a routine follow-up visit. The anterior fontanelle typically closes by 18 months of age, and it can be normal for it to remain open until this age. Given that the child is otherwise healthy and meeting developmental milestones, reassurance and follow-up are appropriate. Answer choice A, check serum calcium levels, is incorrect. While hypocalcemia can delay fontanelle closure, there is no indication of calcium imbalance in this otherwise healthy child. Answer choice B, obtain a head ultrasound, is incorrect. A head ultrasound is not necessary in this case, as there are no signs of increased intracranial pressure or other abnormalities. Answer choice D, refer to a pediatric endocrinologist, is incorrect. There is no indication of endocrine disorders in this child, making this referral unnecessary. Answer choice E, schedule a cranial MRI, is incorrect. A cranial MRI is not warranted in the absence of neurologic symptoms or other concerning findings. The key learning point here: the anterior fontanelle is usually closed by 18 months of age. Question 3. A 3-month-old girl is brought to the pediatrician by her parents for a routine well-child visit. The prenatal course was unremarkable, and the girl was delivered by spontaneous vaginal delivery at term. The parents report that she is healthy and has been feeding well. Family history is negative. The parents are curious about her developmental progress. On physical examination, the pediatrician observes that the infant can lift her head while on her abdomen, follows objects with her eyes, and responds to sounds. Which of the following developmental milestones should the pediatrician expect the infant to achieve at this age? A, babbling. B, crawling. C, laughing, D, sitting without support, or E, walking with assistance? The correct answer is C, laughing. At 3 months of age, expected developmental milestones include rolling, grabbing, social smile, and laughing. These milestones indicate normal social and motor development for this age group. Answer choice A, babbling, is incorrect. Babbling typically begins around 6 months of age. Answer choice B, crawling, is incorrect. Crawling usually starts around 6 to 9 months of age. Answer choice D, sitting without support, is incorrect. Sitting without support generally occurs around 6 to 8 months of age. Answer choice E, walking with assistance, is incorrect. Walking with assistance typically begins around 9 to 12 months of age. The key learning point here, at 3 months of age, expected milestones are rolling, grabbing, a social smile, and laughing. All right, so that's it for this episode, but please do check out our other episodes and all of our content available online at medprep2go.com.
Hey everyone, Chris here from MedPrep2Go, and I wanted to let you know about our premium Step 2 Bundle podcast, which gets you all of the Step 2 secrets and our Step 2 questions podcast combined and ad-free. You'll also get early access to all of our Step 2 questions episodes before they're released public. The bundled podcast is available now, and you can save over 40% with an annual plan. Details at medprep2go.com. Hey everyone, Chris here from MedPrep2Go, and I wanted to tell you about our MedPrep2Go Step 3 review podcast that features over 90 episodes and 40 hours of high-yield content from Dr. Ted O'Connell and Dr. Raj Dasgupta. This is a premium podcast that has already helped over 100 students pass their exam. You can learn more and subscribe at medprep2go.com.